All right, welcome to The Explainer. Today, we're going to break down something that is just so fundamental for any of you in pediatrics, the journey of dental development. And look, this isn't just about teeth. It's really about how you can spot bigger health issues early on. So let's dive in. Okay, so let's kick things off with a super common clinical scenario. I mean, you've seen this, right? A caregiver comes in totally convinced that a pretty high fever is just from teething. The way you handle this, well, it says a lot about providing excellent, safe pediatric care. We'll get back to the real answer on this in just a bit. Okay, but before we can do that, to really get a handle on how teeth develop, we've got to know what they're made of. So let's take a quick look at the 4 core tissues that make up every single tooth. So first on the list is enamel. The easiest way to think about it is as the tooth's personal suit of armor. I mean, this stuff is the hardest substance in the entire human body. It's built to take a beating from chewing. But, and this is a huge but, the cells that create it vanish after the tooth comes in. That means if you damage it, that's it. It's not growing back. Right below that hard enamel shell, you've got dentin. This makes up the bulk of the tooth. Think of it as a built-in shock absorber. It has just enough give to handle all that pressure without cracking. And here's the cool part. Unlike enamel, it can actually do some minor self-repair to protect the tooth's core. And then, right in the middle, at the very core, is the pulp. This is the life force of the tooth. It's got all the nerves, all the blood vessels. This is what lets you feel that jolt from ice cream or hot coffee. It's absolutely vital for keeping the tooth alive, especially when the root is still developing. And last but not least, wrapping around the root, we have cementum. This stuff is kind of the unsung hero of the whole operation. It's a bone-like tissue that acts as the anchor, connecting the tooth to the jawbone with this amazing little sling of ligaments. It's what holds everything tight while still allowing for those tiny, crucial movements when we chew. Okay, this table is awesome because it shows you exactly how form follows function. Just look at the mineral content. Enamel is 96% mineral. That makes it rock hard for protection. Then you have dentin at 60%, which gives it that critical flexibility. I mean, it's just perfect biological engineering, right? All right, so now that we know the parts, let's rewind way back, because this whole process gets started long before a baby even takes its first breath. You know, it's kind of mind-blowing, but the blueprint for every single tooth is laid down at just 6 weeks in utero. It's this complex dance where cells start to multiply and then differentiate, all under the strict command of a genetic program. Genes like MSX1 and MSX2 are the master architects here. If they're not working right, teeth just won't form. It's this incredible microscopic ballet. All right, fast forward a bit. Let's talk about the part that every parent and caregiver is going to ask you about, the arrival of those 20 primary or baby teeth. So, this is the typical game plan for when those teeth show up. It usually kicks off with the bottom 2 front teeth sometime between 6 and 10 months. And by the time a kid is around 2.5, the whole set of 20 is usually there. But, and I really want you to remember this is just an average. Variation is totally the name of the game. So yeah, when these teeth are pushing through, it's not exactly comfortable. You're going to see some really predictable local symptoms. As you can see, sore, puffy gums are at the top of the list. Kids are going to be fussy, they're going to drool a ton. So yeah, these are the big 3 you can almost always trace back to the eruption itself. And this right here is the absolute key takeaway. This brings us right back to that first question we asked. A huge meta-analysis looked at all the data and confirmed it. Teething might cause a tiny bump in temperature, but it does not cause a true fever. So any child with a fever over 104 Fahrenheit needs a proper workup to find the real cause. Blaming it on teething isn't just wrong, it can be downright dangerous. And that's where you come in, because your guidance is so important. Caregivers get desperate, and they might reach for some of these things, but every single one of them is harmful. Benzocaine gels can lead to a serious blood disorder, belladonna is basically poison, and teething necklaces are a massive choking hazard. Seriously, your clear, firm advice here is absolutely critical for keeping these kids safe. Okay, so after those baby teeth have done their job for a few years, it's time for the next big phase, the switch to the permanent set. Now, this whole thing isn't just random, like a tooth gets loose and falls out. No way. It's this really elegant, choreographed process. The permanent tooth, growing underneath, actually sends signals that cause the root of the baby tooth to dissolve. As that root disappears, the tooth gets wobbly, falls out, and boom, the path is cleared for the new one. It usually gets started around age 6.
And this cycle of shedding and erupting just keeps on going, all through childhood, into the teen years, until, boom, the full adult set of 32 teeth is there.
But what happens when that carefully timed schedule gets thrown off? This is where you, as a clinician, really need to have your radar on. Spotting when things aren't quite right is a huge part of the job. So let's cover the big red flags. So here are the 2 big signs you need to watch for. On one hand, you have delayed eruption. That's when a tooth is 6 months late or more. On the other hand, you have premature loss. That's a kid losing baby teeth before they're 4. Either one of these should set off a little alarm bell on your head. It's a sign to investigate further and probably get a pediatric dentist involved.
And here's the so what, the reason this is so important. Sure, a delay might just be a family trait, but it can also be one of the very first clues to a major systemic condition like hypothyroidism or Down syndrome. It's a perfect reminder that the mouth is truly a window into the body's overall health.
And that brings us right back to where we started. Understanding these patterns, these timelines, and these red flags, it's so much more than just knowing about teeth. It's a non-negotiable part of your job in comprehensive pediatric health supervision. Because when you can answer this question, you're proving you don't just see a mouthful of teeth. You see the whole patient. And that's what it's all about.